So today's panel is focused on GPs as changemakers, and we are thrilled to be joined by 6 incredible panelists representing different career stages, different roles, and different passions and experiences. We're going to get to know our panel now, and we're going to give each person just a couple of minutes to introduce who they are and summarize their career journey in a nutshell. We're going to start with Martin.
Anthony, thanks so much, and welcome to everybody. Really great to see you. Delighted that you're joining, and especially delighted that you're interested in general practice as a career. I think general practice is the most varied, most challenging, and most satisfying career in medicine. And I've been a GP for 33 years, probably since I saw my first patient, and I'm just as enthused about it now as I was when I saw my first patient in 1987 as a trainee. So really delighted that you're here. A little bit about myself. I'm chair of the college, chair of the Royal College of GPs. I'm a GP in Newham in East London. And I'm an academic professor of healthcare improvement at UCL as well. So I've kind of got 3 jobs. I've had a very varied career, a portfolio career, I guess. I've been a GP in 3 different parts of the country. I was a partner in Devon and then became a salaried doctor in Moss Side in Manchester, and now a salaried doctor in East London. Across that time, I've also been an academic, mostly doing research, health service research, a little bit of teaching as well. I've also worked in government as a senior civil servant. I've worked in the charitable sector, and I've done quite a lot of work abroad. So I've had a really varied and exciting career, but the one constant is being a GP, and that always to me has been the most important thing that I've done in my career. And it's probably actually when if I'm on holiday and I meet somebody and they ask me what I do, I'll always say I'm a GP before I say that I'm anything else. So such an important career and such an exciting career as well. And I hope that's enough.
Thanks, Martin. Perfect. And next, we'll get to say hello to Sigi.
Hello, good afternoon, everyone. Delighted to be invited to be on the panel. Like Martin, I absolutely love being a GP. I think I've been a GP for 17 years now. I'm a trainer in the practice of about 10 years. And I would say I was probably a mid-career GP, still thoroughly enjoying it, and had a varied career as well. I think probably a lot of the opportunities start in your ST training and taking up chances to teach others and working for the National Education for Scotland. Sorry, I should say that I'm based in a semi-rural practice in Scotland near Edinburgh. I'm currently at work because we're doing our COVID vaccine clinic today. And so started off working with NEST, doing a lot of general practice education, and then local faculty for the college. And I'm currently an executive officer for professional development for the Scottish devolved part of the college. And that has led to a clinical lead for leadership role as well, which has also then led to sitting on some advisory boards for Scottish Government more recently. So I think that the leadership journey is kind of saying yes to as many opportunities as you can and enjoying it as you go. So, thank you.
Thanks, Sigi. Next up, Farzana.
Hello, everybody. Hope you're having a great time so far, and thanks for having me. So I'm delighted that you want to enter or thinking of entering the best career in the world. I might be a bit biased. It's my 20th year as a GP now. And like Martin, I work in Newham in East London, and I'm a GP principal and run a list of 5,000 patients. I'm also a clinical director for primary care networks, which you may have heard of. We're about coming up to a year and a half old, and it's a grouping of practices to help our patients get more care and to support us as GPs. As Anthony was saying earlier, a really exciting time to be a GP, with lots of other people supporting us in general practice now, like pharmacists and physicians associates, lots of other roles. And I'm also co-chair of the National Primary Care Network at the NHS Confederation. And I think change is always with us. And I think for me, I've enjoyed my various roles, and it's really helped me be the mum I wanted to be as well. So when my kids were a bit younger, I was interested in GP education. So I was a GP appraiser, I was a GP trainer. Then as they got older, I got a little bit more time. And my one thing I would say, as Martin says, it's for me, it's about what change can I make for my patients? And we've never seen such a big, rapid change in general practice as we have with COVID this last year. So what will help my patients? Will it be actually keeping them safe from COVID and working a bit more digitally? Will it be thinking about primary care networks so they can get more services? Will it be me being able to have a seat at national tables to influence policy? So I'm so glad you're here. I'm still really enjoying it, and I hope you will enjoy it half as much as I do. Thank you.
Thank you, Farzana. And next up, we're saying hello to Margaret.
Hi, I'm Margaret. I'm a GP. Obviously, I was born in South London to refugee parents, and I find myself here in the Far East, otherwise known as Hull now, where I've been for 10 years. I've been a GP for 18 years and thoroughly enjoying it. And essentially, I think I just got involved with faculty. I applied to a post when I felt the kids were old enough as educational lead for an area called White Rose. So that's an area in Yorkshire that covers South Yorkshire, West Yorkshire and East Yorkshire, where I am. And when I stepped down for that role, still maintained links with the faculty board, and they asked me to become the chair, and I said, okay, why me? And they said, why not you? So I stepped up into that role, and that's just evolved. And now I'm the associate director for the medical school here, Hull York Medical School for Primary Care. So I look after a lot of our students who have primary care placements and their GP tutors. And particularly in the last couple of years, I've become more involved with a lot of medical student groups because they face the same sort of challenges that we faced back then. But the future is very, very different, I think, particularly in the post-COVID era for all of you. And I've got a particular emphasis on cultivating and developing leaders, particularly from underrepresented groups. So I'm so pleased that you're all here today, and particularly that we've got Malone on the panel. Big up to you. So yes, just looking forward to the rest of the discussion this morning. Thank you for having me here.
Thanks, Margaret. And next we're going to Laurence.
Thanks very much, Anthony. So my name is Laurence Dorman. I'm a GP in Kilkeel in Northern Ireland, and general practice is in my blood. I'm the fourth generation in my family, so my great-grandfather was a GP, grandfather and then father, all in our house. So I essentially lived above the shop, and that was fascinating to speak to my father. And actually, I spoke a lot to my grandfather about his experiences of general practice and how a lot of his work would have been done delivering babies in patients' houses. So I know what it means to be a good GP, how much patients value that, how much good can be done with it, and how rewarding that can be as a GP when the job is done really, really well. Like the others, I've had a portfolio career too, which I'm thoroughly enjoyed and thoroughly enjoying. I've done roles with our local hospice, I've done roles in family planning and roles in a GP appraisal. So there's so much variety. Whenever I was coming through medical school and whenever in my early days as a junior doctor, I didn't feel general practice was getting the value or the respect it deserved. So I wanted to do something about that and use my leadership to strengthen it and so on. So I joined the college and we've been able to make really good influence. Myself and my eldest daughter were big fans of Alexander Hamilton, the musical. And you know the famous song about being in the room where it happens. And this is what the college lets us do. It gets us into the room where it happens, whether it's Martin on the Radio 4 Today programme or me meeting Minister Swan in Northern Ireland. It's really important, but unfortunately now it's more in the Zoom that it happens rather than the room where it happens.
Thanks, Laurence. And last but not least, we have Malone. Hi, Malone.
I loved hearing all of the introductions of everybody else on the panel, and thank you to everybody in the audience who's watching. So I'm actually the only person who's not a GP. I'm a third-year medical student at the moment, and I think my journey with leadership is completely different because I have not had the chance to have that portfolio career yet. But I'm the co-author of a book called Mind the Gap, which is a clinical handbook of signs and symptoms in Black and brown skin, which I published last year in August. And since then, the book has been read over 150,000 times in more than 106 countries worldwide. And also the founder of Black and Brown Skin. And we are a group which showcases how presentation is not always the same on darker skins, and we have a website which has over about 100 images of different conditions on darker skins. And I think through that journey, it's made me realize how much you can impact people. Even I'm still a medical student, I'm still learning, but the amount of impact that we have I can't even quantify it. At the moment, we're getting over about 50,000 people a month coming to our website to look for images and to look for resources and help. So I'm not quite there yet, but I'm already impacting people's lives, which is really amazing to see. And I think which is the true nature of being a doctor.
Amazing. Thank you so much, Malone, and thanks to all of our panelists for joining us today. I've got a few questions to kickstart our discussion, but as I say, as we're going through, do put any questions you have on the Q&A. Equally, some of the RCGP team will be checking social media, so if you're putting questions on there with the hashtag DiscoverGP, then they'll be able to feed those into us as well. So I've got a question for each of you. So I'm going to start with Martin. So Martin, you're obviously the chair of the RCGP, which in terms of the work you do there, obviously probably feels quite different to the work you do day to day in the consulting room. So what's that kind of juxtaposition like, being on one hand, the voice of general practice versus a kind of day-to-day GP seeing patients in your consulting room? Oh, you're on mute, Martin.
I'm the first one to do it, but probably not the last one to do it, I suspect. Yeah, so being chair of the college is a really interesting experience, particularly at the moment in crisis. And you're right, it's a very different job. Usually as GPs, we don't have an opportunity to lead a team of 8 officers, a leadership team of 20 odd people, a membership organization of 54,000 people, a budget of 50 odd million. You don't usually have opportunity to do things like that. So it's a really fascinating and interesting experience. I think it's probably lucky that as leaders we're not able to choose our time, because I'm not sure whether I would have chosen to be a leader at the time of the biggest national crisis, the biggest crisis in society, the biggest crisis in the NHS and for general practice that probably we've seen since the formation of the NHS. But it has actually been a really interesting experience. I think the main reason for that is at a time of crisis, people are much more receptive to change. There's much greater flexibility. People are more willing to take risks. They're much more engaged with big kind of societal issues than they might be at any other time. And I think this crisis has produced the kind of conversations within the college, amongst members, but also more broadly in the NHS and in society, which we would never have had in the absence of the COVID pandemic. In particular, the kind of conversations and the kind of activities that we're doing in the field of equality, diversity and inclusion, particularly around diversity for Black, Asian and minority ethnic communities, both clinicians and patients, of course. The kind of conversations that we're having around planetary health, around sustainability, conversations that we probably wouldn't have had with the same kind of intensity as we're having now, the kind of conversations that we're having about inequalities, the kind of conversations that we're having about social determinants of health, all of those are things which I think we're addressing as a college in a way that we probably wouldn't have done, and probably I've never seen happen in my 30 plus years as a college member. So that's really exciting. My big worry as chair of the college was that the priorities that we agreed with the membership just when I started as chair, which was about 3 months before the pandemic hit, which are around improving workload. That's a big issue in general practice. They're around supporting practice to work differently, particularly the use of technology. And they're around promoting what we call relationship-based care. And maybe I can come back to that later, Anthony. I was worried that those three priorities would get lost as all we did was talk about COVID. But in fact, they've actually, COVID has been a really helpful platform to raise the profile of those three issues. And that's precisely what we're doing as a college. So it's been an exciting time. Hasn't always been fun, I have to say, as a leader of change at a time of crisis. But it's been a very fulfilling job. And hopefully members of the college will have seen what a good job we managed to do as a college.
Definitely. I think from just recently finished training, like it's, you know, a lot has happened for trainees as well, and it's been it has been interesting to see just the pace of change that's been happening at the college, the way that different conversations have happened in such a short space of time. And yeah, I think Martin, and I'm sure everybody else on the panel will agree, have done a fantastic job during a very interesting and unexpected time. In terms of that change that kind of Martin's reference there, obviously we can't ignore the fact that COVID has changed stuff so dramatically. Sigi, in terms of your perspectives from that, in terms of the opportunities that this situation might have posed, changes to like being able to develop skills and leadership, how has the pandemic impacted on your career journey, and how do you see it kind of impacting in the future as well?
Thank you. Yes, I think, as Martin said, the pandemic has obviously been running for a long time. It's quite draining, but there has been a lot of good opportunity for leadership. And actually, when I was thinking about it, it was even on a very micro level within the team that we lead here, and keeping staff calm, walking the walk, so to speak, you know, keeping abreast of the constant changes that were happening in terms of the data information we're getting, very quickly moving over to telephone consulting and trying to enhance our digital platforms, which for a long time in Scotland we have been harking on about, I suppose, and we've had rapid changes in the IT we've been provided with. As Martin was saying as well, about thinking about workload, and that has been a big problem, you know, throughout the UK. And just prior to the pandemic, in Scotland, we'd had this Renew GP campaign, and actually I think through COVID we've been able to still promote that and carry on the message about helping with funding and IT. And so there's been micro leadership within my team and keeping everyone supported. But also with that, I think mainly through the role of the college, we've kind of ended up writing blogs and a piece for GP Frontline. There was the RCGP live series webinars. There's been lots of other opportunities to help with shaping the vaccine programme, looking at policy, particularly looking at telephone triage, telephone consulting, and how we might incorporate more of that in our practice in Scotland for accessibility. And there's quite a lot of debate just around health inequalities and who can access the telephone consulting and how we can continue to make it fair. In Scotland, we've got the kind of deep end GP group, which who we sit on various boards with to try and discuss how to continue with access to care, keeping videoing, telephone consulting going. So I think the leadership umbrella has really just bloomed through this period. So yes.
Fantastic. I mean, yeah, definitely, as you say, there's so much going on and so many opportunities, so many more opportunities, and an ever-growing number of opportunities to make change for patients, for the teams that you look after in practice as well, and on a much bigger scale. And thinking about a kind of scale, coming to Farzana, you said you've been a GP for 20 years, and obviously over the last few years with the startup of primary care networks, I think you've become very much one of the faces of primary care networks. I think many of us here will have seen your picture up in Piccadilly Circus, which was fantastic. But going from that kind of being a GP for 20 years in a practice, seeing patients day to day, managing a small team, how has that changed in terms of like thinking about change at like a more population level? How's that adjustment been for you, and how have you grown throughout that process?
So it's a really good question, isn't it? And I think part of the answer to leadership is that I don't think leadership is just about one person in a position. I think we're all leaders, and particularly in general practice, one of the things we do in the consulting room, and what I've always loved about it, is that we actually help empower our patients to be leaders. So you were talking earlier about, little but really significant changes about helping somebody stop smoking. They're actually the leader. We're just helping them. So having this thing called distributive leadership, or delegated leadership, thinking about the fact that we are all able to make change. Human beings are great at making change. If you think about a 6-month-old baby and a 1-year-old baby, they're completely different creatures. They've made a huge change. So we're born with that innate ability to make change. And so I'm very fortunate that in the practice I've got really good support and teams, but also a lot of the basic theme is actually the same. We're here to try and improve care and provide good continuing care for our patients, that relationship-based care that Martin talks about. I may not be an expert in cardiology, but I am an expert in some of the patients and their families that I have known for 18 years. And that's a knowledge that I have that's really, really helpful. And thinking about our why we want to do anything. So in the pandemic, as people have said, the change has been at a really rapid pace, but it has been tiring, and it's important that we look after our workforce, our GPs, particularly our nurses. That's really important, because the work is still there. We're also being able to do exciting things. So how do we deliver vaccination? So one of the things we did at the practice is say, let's do it as a drive-through clinic. Let's get parents to drive their babies in, because we don't want to spend too much time in a COVID place where we might transmit infections. So it's about thinking about who can help me, what is my why, can I actually communicate what it is I'm trying to do? And I've been really fortunate that people are generally interested in hearing. And I don't think I'm atypical there. So I'd say anybody who's on this webinar, we've heard from Malone, what an inspiration. Don't think I was doing anything like that as a third-year medical student, Malone. I was probably still trying to work out which way up, my anatomy went. So you have so much in this, in this audience. You are all leaders. Just go for it, find your passion and make a change.
Thanks, Farzana. And so we spoke about change on kind of a national level, with Martin's role in like the practice, with everything and Sigi's doing, and then Farzana thinking about the impact of primary care networks and population health. I think another important area of changes that we deliver is obviously around education and preparing the next generation for entering the workforce. So, Margaret, from kind of your perspective, what do you think needs to change or has changed about GP education, and how can we empower the next generation of GPs to affect more positive change as well?
Thank you, Anthony. Yeah, that's a good question. So I think there's several things that need to happen. So I can think of 3 immediate ones. So the first one being the curriculum. I think it needs to reflect the fact that the doctors or future doctors that we've got here are going to deal with an ever-growing elderly population, more so than we have. So they need to look at how they're going to prevent, population prevention, promotion of health, and all those things will need to come into play, and they'll need to understand that. But also the medical curricula particularly, and GP curricula need to be culturally competent. How are we delivering education that reflects the needs of the people that we're serving, particularly in a post-COVID era? Sigi mentioned deep end practices. And for medical students, do we know what a deep end practice is? Because these disparities and inequalities in healthcare are just potentially going to widen in the next few years. The second thing is technology. The students here, some of, and Malone, I don't know if remote learning has been a real challenge for us in Hull and York, but we have tried to get through it. But, Farzana mentioned anatomy. I'm a student myself, so Malone, the learning never stops, trust me. I'm a student at St. George's at the moment, and I downloaded a complete anatomy app yesterday, and my mind was blown. I mean, this thing was like in 3D, and I thought, I wish I had this, decades ago. But, so technology is really important. But in realizing that it doesn't replace the doctor-patient relationship, we can't replace that human touch. So always bearing that in mind. We have the rise of artificial intelligence. We know in general practice, we've got lots of systems now that help us to make better decisions. But again, showing compassion, care, or giving reassurance, a machine can't do that. So we need to still retain those core skills. And the last point is, I think, is the education as a team. Our roles are changing. So 10 years ago in my practice, you might find the partners, the practice nurse, and the healthcare assistant. Our teams are so much more diverse now and different. We've got, physician, we've got social prescribers, musculoskeletal physicians. We've got a whole cohort of people and pharmacists that I'd never thought possible. But also coming back to what Malone said about leading, it was Farzana, you can lead from anywhere. And Malone has shown that you can really lead from anywhere. Maya Angelou says, if you don't like something, change it. And that's what Malone's done. So I think education does need to reflect that we need to prepare our future doctors to deliver healthcare that's fit for their future and ours when I'm old. So yeah, thank you.
Thanks, Margaret. And yeah, coming to Malone, obviously we've heard about the incredible work that you've done in your third year, and just in your third year of medical school. What gave you kind of the drive and ambition to deliver that change? I think often, like a lot of medical students and people early on in their career might not feel empowered to be able to deliver change. What gave you the drive and ability to be able to do that, and how did you do such an incredible job?
So I think the drive came from just knowing that there was nobody filling that gap, or there was nothing that I could find substantial to fill that gap. I think as all of you guys will probably know, that first term that you go home after medical school and your family thinks you're qualified to do absolutely everything under the sun. I remember going home and my parents were asking me different things, and I was like, I've been at medical school for about 8 weeks now. Of course, it's only 8 weeks, but I was like, what I've been seeing for the past 8 weeks doesn't compare to what I'm now being shown at home. And that kind of made me realize that actually a lot of the things that we get taught at medical school, although like we just see it through one lens, and we will never know that there is another lens unless somebody else shows us the other lens. And early on in my journey, like you said, I didn't feel empowered enough to speak about it. However, as I kind of kept on going through the course, I was realizing that the more information that I know, the wider that this gap kind of gets. And I didn't want it to get to a point where this gap is so wide that it's impossible to fill. And I feel like that's what many senior doctors felt like. So when I was speaking to them, asking them questions like, what can we do about this? A lot of people would often tell me that actually there's nothing that you can do. So with regards to the change and with regards to like leadership as a whole, I thought the only thing that I properly can do is influence my clinical skills department. If we can change the clinical skills department, then we have changed potentially all of the medical students behind me coming up. And that was our aim at the start. Of course, it kind of spiraled into like a global change. But I think like Margaret and Farzana and Sigi have mentioned, is that I think change really comes from changing where you are, because I don't think it's possible to change the whole world or to change the nation or to change your county if you can't change where you are. So it's kind of like moving that first stone, and eventually you'll realize that moving stone by stone, you've moved the whole mountain.
Thanks, Malone. And we've got a question in the chat as well about kind of balancing being able to deliver this change while still at medical school. And another question in the chat about the resources and support that you needed to get your book published. How was the experience of trying to balance going to medical school during a pandemic, doing all of this other fantastic work? Were the medical school supportive? What other kind of support did you need to be able to deliver this?
So I think it was a very interesting time, because nobody really had an answer to what's going to happen next. I remember when we were in the process of creating the book, that's when the pandemic hit, like midway, and we weren't entirely sure if the book will ever make it out, because a lot of the things that we were doing, we were meeting up in person, discussing. However, now we're online, and nobody could use Zoom or Microsoft Teams back then. With regards to support, it was really difficult because, of course, the issue that I'm talking about almost feels like a taboo to some. People don't often like to have these difficult conversations about race, even though the statistics which are out there show that we actually need to sit down and have the conversation, because if we're not having the conversation, these health inequalities are widening day by day, and COVID accelerated them even more. So with regards to that, it was kind of like, I had to know why I was doing it. And every time things would get tough, I would have to resort back to, why am I making this handbook? What do I want to gain out of it? And I think it was just acknowledging that that why was bigger than what I was doing. So that was kind of what kept me going all of the time.
Fantastic. So we've got a number of questions in the chat already, so please do keep submitting them there. We've also got a couple of live questions which we're going to take from audience members. So we've got a question from Sally in Lancaster.
Hi, yeah, my name's Sally. I'm president of Lancaster GP SOC, and my question to the panel today is, if we're to take more steps forward with medical teaching and representation for all communities and groups within our population, obviously there's still quite a lot of work to be done. So how are RCGP already involved or going to help represent LGBTQ+, trans and BAME communities within medical education, ensuring that tomorrow's doctors have a wider appreciation for more appropriate and safe care of these patients, and also ensuring a compassionate and inclusive environment for all the practitioners who are part of these communities?
Thanks, Sally, for your question. Great question. Yeah, I'm not sure who wants to tackle that one first. Obviously, the college has been doing a lot of work around trying to better represent both members and patients. Margaret, do you have any kind of comments for Sally?
So from a college perspective, we have been really proactive in the last year, particularly, but actually the effort started way before last year with engaging Black GPs and, Black and Asian and minority ethnic GPs and GPs from ethnically diverse communities. We have 5 task and finish groups that address different, whether it's CPD or raising awareness or working with stakeholders. So it's a real collective effort. We can't work in silos. And the college is working as well with Health Education England. We're delivering, race equity workshops right across the board in collaboration, because it's a collaborative effort. The other thing that I need to mention, a lot of medical schools now are actually signed up to the BMA medical charter. So if you haven't seen that, it's always worth a read of that charter, because as in Hull and York, our students know that they're free to speak up, and they know where to go if they need to complain. And we need to instill confidence in them that when they complain, we will deal with their complaint as well. It's not just a token exercise. There's also the Athena Swan initiative. There are about 10 core principles there. So that's another charter you should look at. And that also helps us to represent, because we're signed up to that as well, it helps us to represent those underrepresented groups. So, for example, our members from the LGBTQIA plus communities, women, and we're doing all sorts of things, whether it's discussing STEM or the pay gender gap, so it's a minefield, but there are lots and lots of things that are being done, but we can't do them alone. We need to work together, as the last year has shown us through COVID.
And Martin, yeah, you've got your hand up. Obviously, as head of the college, I know this is a big priority area for you as well.
Yeah, it's a massive priority area, and as I described earlier, there's a real opportunity now at a time of crisis when people are much more engaged in addressing big societal issues, enduring problems that have been around for so long. And I think as a college, we have such an important role, because we're a well-respected organisation. We're an institution amongst many institutions in the country, and so we have such an important role in pushing the equality, diversity and inclusion agenda, starting with getting our own house in order. And that's what, as Margaret's described, that's precisely what we've been working on over several years now. And Margaret's described some of the working groups that we've got. We've got enduring issue, like all medical royal colleges, around exams and differential attainment between different ethnic groups. Our college was the first to actually publish data to demonstrate the level of differential attainment that existed, and that's something that we're proud of, but we've demonstrated a problem which we're now working on together with educational bodies across the country. So there's lots of ways in which we are working in order to create a much more inclusive college, and one that basically represents the nature of the workforce in general practice and the nature of the communities that we're serving. Somewhere around between 35–40% of the workforce are from Black, Asian and minority ethnic communities. And our council represents that. We've got a similar kind of proportion of people from BAME communities actually on our council. We've still got a long way to go as a college, but I think we're moving in the right direction. I think it's really exciting work, and fundamentally it makes us a better organisation, and that's what we're here for.
Definitely. I mean, I think as a gay man, when I was a trainee and got involved with the LGBT steering group at the college, it was in many ways like it just felt so nice to feel that there was a home and that this was recognised as an important area at the college, which is something that hadn't happened throughout my medical career or my medical school time up to that point. So I think this is fantastic that the college is now being really proactive in this area, and that hopefully we can continue to do this work. From a devolved nation point of view, Laurence and Sigi, is the situation when it comes to equality, diversity and inclusion any different, or is there any other kind of successes that you've seen happening in your areas?
So it's different in Northern Ireland. Well, there's one of the big differences in Northern Ireland is for years we had obviously issues, with religion and so on, and a lot of civil service and government posts were done on quotas. And again, they were felt to be sort of less beneficial, but we do have issues and so on that we address, and we try and keep our council as proactive and as inclusive as we can.
Yes, Sigi.
Yeah, thank you. Just quickly to reflect Malone's point as well, I think there's also something looking at medical school curriculum and preparedness for different types of clinical cases that we're coming across, and are we getting enough ethnicity and diversity in the cases we're teaching our students, and also obviously our GPST teaching. The other thing that's happened in response to the differential attainment kind of reporting by RCGP in Scotland and South East, we've developed the STEP programme, which is for trainees to access. Anyone that has trained outside of the UK is invited to that programme alongside of their trainer. And that has proven to be very successful. It's been running for a few years now, and it covers a huge amount of information, including kind of cultural things such as settling, getting car, accommodation. It looks at everything. If you think about Miller's pyramid, it's not just about the kind of communication skills and the higher level GP training. It's a bit of a cultural, I suppose, ingraining program for those that haven't trained in the UK, and it has been really popular. That's called the STEP program. And I think Martin's right. We're talking about it a lot more than I've ever experienced in my career, and I think that can only be a positive. And talking about BAME issues, LGBT issues, QI issues a lot more, and that's fantastic. And I think keep the ball rolling and keep the discussions and going. So yeah, thank you.
Thank you. And I think, or maybe Margaret, you've already answered it, but I think the kind of terminology is so important, and there was a question around the use of the terminology of BAME. I think you've already written it there, but for the rest of the audience, is there any comments that you'd like to make on that?
There's no right or wrong. I think you just have to say what you feel comfortable saying. Doyen Atewologun and Roger Klein were authors of a Fair to Refer report to the GMC. And Doyen talks about, when you say BAME, to try and actually spell it out. What is it? Black, Asian, minority, ethnic. But the black doesn't include, what does that mean? Asian, South Asian, what does that exactly mean? So there is a change now to move away from using the terminology, but that will take time. So I try not to get, over emotional or, particular about it, but I've posted a link for a government website which kind of explains it a little bit more than I'm doing now, as to perhaps how we move away from that terminology to a more inclusive term.
Yeah, definitely. Thank you. Thank you, Sally, for your question. Really, really useful and great to hear everybody's feedback. We've got another question from the audience from Marcus. Hi, Marcus.
Hi, nice to meet you guys. So hi everyone, my name is Marcus. I'm a fourth year medical student at Sheffield. I've previously served my local GP society as a external liaison with the local faculty. And I'm currently involved in organizing a national student-run symposium on research and general practice. So medical students, do keep your eyes peeled for that. I'm going to preface my question with something I read in the BJGP recently. So a key challenge to GP, as we're all aware, is the falling GP to patient ratio. And this was a 2020 October BMJ analysis article by Stavely and Sampson. They emphasized the importance of addressing the UK's falling GP to patient ratio. They talked about a holistic approach, championing retention, supporting staff engagement, and so on and so forth. Now, part of the UK's approach to improving GP numbers is international medical graduate recruitment. I'm an international student, and a third of all our clinicians here in the UK are either international graduates or, like myself, training here in the UK. So my question is this: in what ways will the RCGP champion retention, engagement, and satisfaction of international medical grads and trainees in general practice? Thank you so much.
Thank you, Marcus. Perhaps if we come to Martin, first of all, just to give some initial thoughts on this.
Yeah, thanks, Marcus. This is probably the biggest challenge that we have in general practice from a policy perspective at the moment. We're under-doctored and we don't have enough non-doctors, other clinicians in the workforce either. And that's been recognised for a long time. And successive governments have attempted to do something about it and largely failed to address it. Which has been really depressing. So there have been commitments to an extra 5,000 GPs in 2016, didn't happen, an extra 6,000 GPs by 2024. We're working hard to encourage it to happen. The main problem, well, a few years ago, the problem was both recruitment and retention. It was getting, guys like you and Malone into general practice. That problem is largely solved now. We've got a massive number of training places, which is growing each year, and the fill rate is more than 100%. For those training places. General practice is a really exciting career. I think we've got that message across and people want to be GPs, which is great. So we've got the taps full on, if you like, but the plug is still out, and that's the problem. We're having trouble retaining GPs, particularly GPs of my generation, either because they're working part-time or because they're retiring early. And that's the biggest challenge that we're, excuse me, that's the biggest challenge that we're facing at the moment, and we're doing a range of things in terms of creating attractive jobs to people later in their careers. For example, salary jobs, 4 sessions a week, maybe 3 sessions face-to-face, 1 session as mentorship for the next generation of doctors, those kind of career jobs, which I think are going to attract more people back into general practice. But fundamentally, what we need to do is to address workload, and that comes back to one of our strategic priorities. The problem with general practice at the moment, it's a very difficult job. So when I started as a GP, I was seeing probably a busy day was 20 or so patients a day. Now a busy day in my practice is somewhere around 50 patients a day. And it's quite challenging to provide really high quality care for that number of patients. And that's why we're doing so much work in not only increasing the size of the workforce, but also helping practices to change the way that they work, to change the role of the GP alongside non-doctors in the primary care team. So a whole range of areas of work that we're doing in order to make general practice a more doable job, if you like, and to build the size of the workforce as well.
Thanks, Martin. And Farzana, from your kind of perspective, from like a primary care network level, you've obviously mentioned also like additional roles coming into general practice as well. What does it feel like on the ground for people running primary care networks when it comes to recruitment, retention, and the issues that Marcus has raised?
Well, I think it's a work in progress. As Martin says, it's a very busy workload at the moment, and this in itself is making a lot of people perhaps leave earlier than we would want to. There are fantastic roles. There are already 12 roles, from dietitians to podiatrists to paramedics. But these people will need time to become part of primary care teams. So it is a work in progress, but definitely it's there. As Martin says, these are wonderful people, but they're here to support GPs. They are not GPs. They don't want to be GPs. So it is part of a team. It's not going to plug the gap that we have of not enough GPs, but certainly a support. But that GP retention and recruitment is still absolutely vital, because we offer something a little bit different to a paramedic or a physician's associate. Everybody brings something different to the party. So a huge support. Not there yet with embedding. The primary care networks are definitely here for at least 5 years, but we're not even second year in yet. But we still need GPs. And as Martin says, great to have people coming in, and it's about thinking about what we can do together to make sure that people want to stay.
Thanks, Farzana. And Malone, as someone who's still at medical school and the very early stages of your medical career, obviously there's always talk about workforce crisis, not just in general practice, but in the whole of medicine. How does it feel to be a medical student in this kind of current climate? Does it make you apprehensive about the future of your career, or are there any things that you think really need to be tackled to make people want to stay in the profession that they've trained and studied so hard to be part of?
I think it definitely does make you apprehensive, and the whole debacle about the pandemic makes you almost open your eyes to what potentially we may be getting into in the future. I think with regards to medical student morale as a whole, I don't think the morale of medical students up and down the country at the moment is the highest. I think it must be the lowest it's ever been, simply because we have all had to compromise, whether that be learning or teaching time or adapting to online sessions, and everybody is finding it difficult to get through. However, the demands which are being placed on us are the same as previous years where there wasn't a pandemic going on. I think going into the future, what needs to kind of change, or not necessarily change, or be highlighted a little bit more, is from people within the profession how it actually is, because I think the COVID pandemic made us realize that this profession that we're going into, everybody looked at it, of course, because we all want to go into it, as like the prettiest thing in the world, but the pandemic almost showed us the bad side to some of the things going on, just due to all of the politics that were associated with the job. So I think going forward, I think events like this, hearing from GPs directly themselves, hearing from other medical professionals themselves, to tell us how actually it is working on a day-to-day, because there's only so much that you can pick up from going to placement. You're always going to see the good side of things, but sometimes I think to make the most informed decisions, whether to make the most informed decision about what speciality you want to go into, you also need to be aware of some of the bad sides as well. And I think being aware of the bad side sometimes as well, the person I am, can make me optimistic, because I'll be thinking, actually, this is bad now, but by the time I get there, I'm hoping that it's not bad.
And definitely, and with people with your drive and determination, you can definitely make things better as well. So thanks, Malone, and thank you, Marcus, for your question. The time has swiftly got away from us, so we are running a tiny bit over. I don't want to eat too much into everybody's lunch break. So we've come to kind of our final question, which is a key piece of advice that our panelists would give to young leaders and people thinking about a career in general practice, things that you might have done differently, or a key takeaway that you think can help people when it comes to making change. So if we start with Martin again.
So my advice about implementing change and being a leader, based on kind of what I've done in my career. I'm so inspired by Malone. You're such an amazing guy. I'm so looking forward to you taking over as chair of the Royal College of GPs at some time in the future. And I've got no doubt that you will, because you're developing your skills, you're testing things out, you're learning. I assume you're probably making some mistakes as well as doing brilliant stuff, and that's great. So you'll learn from it. So my advice is number one, give it a go like Malone. And make mistakes and learn systematically from your mistakes. That's really important. And number two, be opportunistic. There's so many. One of the great things about general practice is the flexibility that you have, and opportunities will always come your way. So seize them. And some of those opportunities, as I've experienced in my career, some of those opportunities will just open up new pathways and new horizons and will be brilliant. Some of them will be disasters, will be big mistakes, but still learn from them and move on. So that's really important. And then the final thing I think is something that I've learned from a lot of experienced leaders is be planful. So don't assume that just because you've got natural leadership skills like Malone has clearly got, that you can kind of be a bit lazy about it and just do what you like. Think carefully about your leadership skills. Think about how you want to develop them. Create your own narrative, your own story around yourself, something that describes kind of what's important to you, what your values are. And that way you'll develop your career really effectively and be a really good change leader.
Thanks, Martin. And then if we go to Sigi.
Thank you. Yes, just to reflect those thoughts, I think that's absolutely it. One thing is imposter syndrome. You know, try to ignore that negative voice. Believe in yourself, as others might. You know, seek out role models who you really want to emanate, and believe in your innate kind of ability to care and be very value driven. I think our recent chair, Carrie Loonan, was very value driven in the way that she chaired, and that then has a knock-on effect and lots of positive change, right from government policy to education at medical school and GPST training. So be value driven, believe in yourself. If there's opportunities there and you have capacity to do them, you know, jump in with both feet and give it a go. And I think what Farzana was saying, very much collaborative leadership, you know, lead beside your team, beside those with you, and you'll enjoy it a lot more. But yes, I think that's what I would say. Yeah.
Thank you. And then next we go to Farzana.
So yeah, everything that's been said, and I think just shape it. Do what you want to. I still giggle a bit when people say you're a leader. I've never thought of myself as a leader. I've just been happy being a GP, but happy doing the things that I've wanted to. And GP, as Martin said, does give you a huge variety of stuff you want to do. So I liked medical education. I wanted to do it, but it also fit in with the hours I wanted to work to be a mum. I'm not a cardiologist. You know, a lot of people said, you're a woman, you must love women's health. Well, actually, I don't. So you know, find stuff that you like and go with it, and just follow your passion, and don't worry, as Martin says, about making mistakes. And we're talking about making change. You might just change as you go. I never thought I would be representing primary care networks because they didn't exist, but now I am. But what I do know is that I want to make change for the better for my patients. That's something that drives me. So find your passion, go with it. Don't worry if it doesn't work out. There's plenty of other things you can do, and stay away from things that you don't like. You don't have to be a martyr about it. Just find something that you do like. Work on the strengths, because we all have a gift.
Thank you. That's fantastic advice. And Margaret?
So yeah, I echo all of the above. Be bold, be brave, be yourself. If I can use what Farzana mentioned, to surround yourself by leaders, and because who you know affects what you know, essentially. And if they're relatable, that's great, because we do need relatable people. But sometimes think about people like Sigi mentioned, Carrie Loonan. She starts her meeting, and I'll never forget when she said this, who's missing? So, and do that for your own life. In my life, who's missing? And so I picked the most unrelatable person that I can find. And actually one of my mentors is a very senior GP, male, and you know, he's actually moved probably into bestie category, if I'm honest with you. So surround yourself by mentors, leaders, coaches, sponsors, whoever, to aid you on your journey. Thank you.
And Margaret's also shared, I think, a link for the RCGP's new mentoring platform in the chat as well. This is a really fantastic resource for people to get involved with. If you're looking for a mentor, someone to offer specific advice, this is a really great opportunity. So do check it out and sign up for it as well. Thank you. So Laurence, what would be
so just echo the others. So you'll find something you're passionate about it and pursue it and follow it. Never be afraid to network. Networking used to get a really bad rep, but actually networking is really, really important. So it is. And always remember, if somebody is an expert in something, usually it's their favorite topic to talk about. So never be afraid to approach them. They'll always want to share their stuff with you. So always be prepared to approach somebody who is, you know, renowned about something. And the other thing is be kind. Both to people around you and to be kind to yourself as well. Don't be too critical. Michael West talks about compassionate leadership, and I think that's really important.
Brilliant. And finally, we'll come to Malone. What would be your words of advice?
I have a lot of thoughts on this question. I think to almost echo Sigi's comment about imposter syndrome, I actually tweeted just before we started this panel about how this time last year imposter syndrome would have been tearing me down. I think imposter syndrome is one of those things that I think it happens to everybody. So I think my advice would be to almost acknowledge that some of these things are inevitable to happen, like imposter syndrome, and even failure. I think failure is so inevitable, and once you accept that failure is inevitable, I think that will kind of give you the drive to go forwards, because you're going to fail anyway. So if you put off doing something because of failure, like, there's no point. I think you have to start with why you want to do something, because when things get tough, that is what is going to keep you going. And if you start with that why, when you get to points of failure, the why is the thing that just keeps going on in the background. So for me personally, my why is I want to help people. I want to help communities who have almost never been given a voice in healthcare from like 200, 300 years ago. And how that looks or what that is, today is in the form of a handbook and a website. Tomorrow it may be in the form of a TikTok page. However, the why is always going to remain the same. And then I think just the final point is just go out there and do. Like, don't be afraid to fail yet again. Fail fast, fail forwards, and yeah, like, the world is your oyster.
Thank you so much. I mean, we could sit here all day. I think, you know, from amazing panelists, you've had so many different perspectives. You've seen such a wide range of different opportunities that you can have through a career in general practice and before with Malone as well. So thank you so much for sharing so candidly and honestly with everybody on this Zoom today. Thank you for joining us today, and enjoy the rest of your day at Discover GP 2021. And thank you so much to our panelists for giving up their time and speaking with us today. Take care, everybody.